World Keratoconus Day is for me personally, but I'm sure to a larger extent to both patients and the keratoconus care provider community is a very important day to recognize not just the hardship that the patient is undergoing after being given a diagnosis, and sometimes the frustration of not having been diagnosed for a long time and not knowing what is happening to them. So the World Keratoconus Day for me recognizes that. It shows that we are part of the same community. We're standing in solidarity with our patients and prospective patients, and that there is, everybody's coming together in the interdisciplinary way to make sure that their care is the best possible. Nowadays, when a patient is first given the diagnosis of keratoconus, yes, it is obviously a very unfamiliar and scary process. But I do want my patients to know when they're being diagnosed and when they're being told that this condition is naturally degenerative and you'll lose vision naturally if you don't do anything about it. The prognosis nowadays is completely different. And this is the reason why World Keratoconus Day is very important, to share information with patients about the type of future that they can have. And that is, now that we have FDA approval on corneal cross-linking, we can stabilize their condition as long as we can detect them early, which obviously is the importance of going to your eye doctors regularly so that they can be detected using advanced technology with regard to their eye conditions. And so when they're detected early, they can then be offered this treatment. And with the FDA approval, insurance reimbursement also is improving inside the US, which is going to lessen patients' financial burden. And therefore, when all those things are adding together, it is no longer a scary process. We're with patients every step of the way to help them throughout this rehabilitative process. The trajectory of a patient who's newly diagnosed with keratoconus is now a very promising one. No longer is the prognosis of the condition something that will get worse on its own with nothing to do about it. Now that we have FDA approval on corneal cross-linking since 2016, and with improvement in the insurance payer reimbursement, the future looks really bright for keratoconus patients because as long as they're being monitored carefully by their eye doctor, and if there's any progression or worsening of their condition, corneal cross-linking can now be offered right away to stop the progression of the disease or greatly slow down the negative prognosis of this condition, and thereby giving patients a lot of assurance that they are well taken care of. I want patients to know that not only does this day recognize what they're going through and the efforts from their doctors and their caretakers who are obviously doing the best they can to take care of them, and the advocacy effort from National Keratoconus Foundation. I also want them to know that we do recognize the uniqueness of each individual, that just because you're being given a same diagnosis as other keratoconus patients does not remove the fact that you are unique in your life, lifestyle, in your clinical needs, and that never to be afraid to ask for treatments that are customized to you. And of course, that in my mind will always include corneal cross-linking as the base to make sure that you are stable for as long as possible, and therefore you can maintain the quality of your life the way that you want, and then go on and live the most productive life you can.